Hello, everyone, and welcome to Career Day. My name is Ben Gliko, and I am a clinical neuropsychologist. I'd like to thank you for watching my video. So hopefully, I'm going to get you interested in neuropsychology as I explain to you what it is and why I love it so much. As you can tell by the pictures, clinical neuropsychology has a lot to do with the human brain. So I wanted to start with just some fun brain facts. Um, if you look here, this yellow circle is a cell body. So the brain is made up of what we call gray matter and white matter. The gray matter of the brain is all the cell bodies of the brain. So there are 100 billion neurons in the brain approximately. That's a huge number. If you stacked up 100 billion sheets of paper, that stack would go about 8,000 miles, which is just crazy. If you counted one number per second, it would take you over 3,000 years to count up to 100 billion. So that's how many cell bodies we have in each of our brains. Now you can see this, which is called an axon. This connects one cell body to another within the brain. This tract is what we call white matter. So again, the gray matter in the brain consists of these cell bodies. And then the white matter are the different connections between all the cell bodies. So again, we have about 100 billion cell bodies in the brain. And there are about 85,000 miles worth of axons or white matter tracts in the human brain, which is just really, really crazy if you think about it. So the brain really is the most complex object in the entire universe. And I don't think that's going to change. And that's one of the reasons why I love neuropsychology so much and what I do, because I get to think about the brain all day. Okay, so quickly I just want to show you a couple actual brains. If you look here, this is a mouse brain, pretty small. Here we have a baby pig, a little bit bigger, it's upside down in there. Here is a cat brain. And here we have an actual human brain. This is the brain of someone who donated their body for scientific research. This is from my hospital. So this is a adult human brain, pretty amazing. Look under, you can see different parts. Here's a large blood vessel and cerebellum. And here is one half of the brain, which has been taken like this, so you can see some of the inside. This is called the corpus callosum and the caudate in here. This is a ventricle, this space where cerebrospinal fluid is housed. And then just really quickly, this is a spinal cord, human spinal cord. And if you weren't grossed out enough, this is called the dura mater. So this is a hard protective covering that sits on top of the brain when it's inside your skull. It's typically very hard and difficult to tear with your hands, but this is pretty old. So this is what I want to accomplish here today. So first, what is neuropsychology? Well, briefly, it's an area of psychology that examines the relationship between brain functioning and observable behavior, and I'll talk more about that in a minute. So I'm a psychologist, but I have a specialty in neuropsychology. Psychology is really a large field. Most people, when they think of psychology, they think that the person does therapy or counseling all day. And that is a big part of what most psychologists do. But as a clinical neuropsychologist, that's not what I do. I do more assessment. And again, I'll talk more about that. So in order to work as a neuropsychologist, you have to go through a lot of education and training. So if you're someone who doesn't really like being in a classroom setting, doesn't like to read textbooks and study, this may not be the best career choice for you. Um, so to work as a neuropsychologist, you have to start with your typical 4-year college degree that most people get right after high school. That's what we call an undergraduate degree. And that 4-year college degree, typically neuropsychologists study psychology, but they can get a college degree in other areas too. So maybe like neuroscience or even biology. But so you start with that first 4-year college degree. Then you have to go on and get a second college degree, what we call a graduate degree, and that's a doctorate in psychology. That's a 5-year degree program, the last year of which is a full-time internship where you're actually doing that work under supervision. So now we're at 9 years of college work after high school. You then have to pass a licensing test to work independently as a psychologist. But if you're going to enter into neuropsychology, you then have to, after you get your doctorate, do 2 more years, what's called a fellowship, specializing specifically in clinical neuropsychology, where you're again working full time with a neuropsychologist, learning how to do that work. So now we're up to 11 years of training, formal training after high school in order to work as a neuropsychologist. But for someone like me who really loves this type of work, it was certainly well worth it, but something to consider if this does sound interesting to you. So what does a neuropsychologist do? Really what I do when I work with patients is gather information about them. I gather information about their thinking skills, or what I would call cognition. I gather information about their emotional functioning and their behavior. And I'll talk more about these in detail. But so in doing that, what I'm conducting is a neuropsychological evaluation. And that consists of an interview. So I'll spend 1 to 2 hours talking with the patient initially to learn more about their thinking skills, emotions, and observe their behavior, but also just ask a bunch of questions about their background to learn as much as I can about them in that period of time. So after the interview, the patient will complete a bunch of short little tasks, and that's how we try and tap into all those different areas of thinking skills that the brain controls. So we might read them a list of words and ask them to try and remember as many of them as they can. We'll ask them to solve some puzzle type tasks, ask them some knowledge type questions. So that's how we try and assess their thinking skills. The patients will answer one or a few questionnaires, which tap more into emotional functions and behavior. And then we're always observing their behavior, looking for potentially problematic behavior like distractibility, inattention, impulsivity, aggressiveness, problematic behaviors like that. So the day that they come and see the neuropsychologist, we're just collecting all of that information. A couple of weeks go by and we write a pretty detailed report, meet with the patient again and their family and talk about all the results and most importantly, what to do moving forward. So the purpose of all of this is it helps me learn a lot of detailed information about this one patient. I can learn about their thinking skill strengths and weaknesses. I can learn about their emotional functioning, and I can learn about their behavior. And what this does is it really paints a comprehensive picture of who the patient is. And that's really helpful in a couple different ways. Number one, figuring out what's going on with the patient, or what we might call, making a diagnosis. And then also, it's helpful for treatment planning, thinking about what will be helpful for the patient moving forward to help them function as well as they can. So that's how neuropsychology is helpful. It helps us figure out what's going on at the level of the individual patient, what we might call diagnostic clarification. A quick example of that would be, let's say we have a 70-year-old person who's starting to notice memory problems day to day. They go and tell their doctor that. It's difficult for that doctor to know whether those memory changes the person is concerned about whether they're just the normal age-related changes that come with aging, which happens to everyone, or is it something more serious than that? Is it maybe the beginning stages of some type of dementia? Oftentimes, in that scenario, the doctor will refer their patient for a neuropsychological evaluation, because all those tasks that we use, we can compare the patient's results to other people who are similar to them in terms of age and sometimes other variables. So we can pretty easily answer the question of whether that 70-year-old's memory functioning is where it should be given their age, or whether it's not. And if not, what do we think is going on? And that's important because getting the right diagnosis leads to the right treatment. Another way neuropsychology is helpful is it helps with patient care and treatment planning. So thinking about how this particular patient's brain illness or condition affects them and what will help them then. So I work with a lot of patients with neurological conditions like Parkinson's disease, traumatic brain injury, multiple sclerosis. And two people with multiple sclerosis, that illness will affect each of them differently. Same thing with all those neurological illnesses. So if I work with someone with multiple sclerosis or Parkinson's disease, again, I'm seeing where their unique thinking skill strengths and weaknesses are, how the illness has affected them emotionally, and how it has affected their behavior. And all of that rich, detailed information is very helpful in thinking about what will be helpful to them moving forward so that they feel as well as they can and function as well as they can. So where does a neuropsychologist work? Typically in hospitals. I've worked at a veterans hospital in Chester County, Pennsylvania for about the past 13 years. Prior to that, I worked at a large acute care rehabilitation hospital, which means I would see patients there who had just recently had a major stroke or traumatic brain injury or a tumor removed from their brain. Where I work now, I see a mix of what we call inpatients and outpatients. So outpatients are people who drive from their homes to the hospital to see me, and then they go back home. Inpatients are people who either live in some type of hospital setting, like in a nursing home perhaps, or who have been admitted to some hospital program for medical care. Other than working in different hospital settings, neuropsychologists often have what's called their own private practice, so kind of their own office in the community where they get referrals from different healthcare providers. COVID, to say a couple words about that, has really affected how I do my work. Typically, these evaluations are done face-to-face in my office, but I've been working from home since the end of March of last year. And our hospital has done a really good job of helping us adapt what we do to video-based evaluations. So that's what we have been doing in our clinic since the end of March last year, 100% video evaluations, where we've been able to gather digital stimuli and tests that we can share our screen with the patient and have them look at that. And a lot of what we do is just talking anyway, so that translates pretty well over the video. So we have been 100% video-based in our work since last March, and overall it has been going well. It's not quite the same thing as doing it the normal face-to-face way, but it also has its advantages. For example, people don't have to travel to the hospital. They can do this lengthy evaluation from the comfort of their own home, which is a nice thing. So that is it. I hope this was at least somewhat interesting to you. And if you have any questions about this, I'm happy to speak with you more. Thanks very much.